find yourself tuning up the TV so you can hear it better? Or are you asking others to repeat what they've just said? If so, you may need help with your hearing. Dr. Sarah Mowry has joined us in the UH Broadcast Center to address hearing issues. Dr. Mowry is an ear, nose, and throat specialist with University Hospitals who specializes in hearing and balance disorders. So welcome to our show.
Thank you for having me.
Is hearing loss just inevitable as we age?
No, not necessarily. There are definitely patients who don't have any hearing loss into their 80s and even their 90s. But for many patients, it's a combination of what I like to call a lifetime of use with other predisposing factors, maybe a familial hearing loss or a genetic underlying predisposition.
Okay, so you mentioned noise and use. So those rock concerts we all went to as a kid, probably not a good thing?
Well, it certainly doesn't help. And many patients will describe having ringing in their ears after leaving a loud concert or a place where there's a lot of noise. And that ringing in the ears is a sign of some underlying damage that can happen in the hearing organ. But then over time, the combination of exposure to life with those other loud noise exposures can lead to hearing loss.
How can we really know for sure we have hearing loss?
Well, ask yourself honestly, do you think you have a hearing loss? Many patients, if they're honest with themselves, will recognize that there may be something going on. But the first place to start is probably with your primary care physician, who can order a hearing test, and then we can get some specific information about what's going on in the inner ear.
Okay, so what's involved with a hearing test?
Well, you would go to see a licensed audiologist, and we can test the ability of the sound to be transmitted to the inner ear, and that involves testing the eardrum and the ear bones, but then we also test the ability of the inner ear to convert that sound energy into an impulse that goes back to your brain. So we test two different parts of hearing.
And so there are two different tests that you're sitting there going through.
Correct. Yes.
One is whether you hear it or not, and one is whether you understand it or not.
Yes, the inner ear plays two different roles. So not only do we hear the sounds or the tones, which, as you may remember as a kid in school, getting your hearing tested and pushing the button, but we also test the ability of the inner ear to discriminate what those sounds mean. So some patients will have the ability to hear sound but not understand what that sound means.
Okay. So if the tests do show that there's hearing loss, what's the next step?
Well, the next step would be to talk to your audiologist about what would be the appropriate management. For many patients with an inner ear hearing loss, the appropriate treatment for that would be some amplification or making the sound louder with a set of hearing aids to help you be able to hear when people are talking.
What about if it's the other kind?
Well, the ability to understand words unfortunately is not always treated effectively with a hearing aid, but we need to make sure that you can in fact hear the sound. So for most patients, that is still the appropriate treatment, is to use a traditional hearing aid system.
Okay, are hearing aids all pretty much the same?
No, that's a great question. There's a lot of different technology, and the technology has improved significantly over the last 10 to 15 years. I don't pretend to be a hearing aid expert because that technology is always changing, but talking with the audiologist, you can decide which levels of technology and which bells and whistles would help the most in your specific listening situation.
Okay, so there's help. That's a good thing to know.
Absolutely.
If people keep saying, "Can you hear me now?" then now might be the time to get your hearing checked. Follow Dr. Mowry's advice and see your primary care physician to start the process. My thanks to Dr. Mowry for giving great information that we all heard, I think, loud and clear.
Learn more by calling the Center for Lifelong Health at University Hospitals at 1-844-312-LIFE. That's 5433. Or visit their website, www.uhhospitals.org/lifelonghealth.